Hi, I'm Dr. P.C. Jagadeesh, Senior Orthopedic Surgeon.
Hi, I am Subramanya Kushtagi. I'm a plant manager at one of the oldest American multinational company. So what happened was I had a problem since about almost about 10-15 years. My shoulder used to slip and I used to manage somehow. But what happened then a few months ago, I thought I improved my strength on the shoulder. So I thought let me play tennis. So I played tennis for about couple of hours, but then I started getting pain in my shoulder, and I thought it will go, but it started hurting me very bad. Then when I showed to one of the doctor, I was told that it was a frozen shoulder. Now, initially when I encountered this problem, because it had a history of shoulder slippage, or when I met a few doctors, one of the doctors suggested that I had to undergo surgery to get this sorted. But then somehow I was not happy. Then I was also advised physiotherapy. Yeah, so that was the initial start of my problem. One of my cousin referred me to Dr. Jagadeesh Jas Center, and I'm very happy that he referred me here because I got my problem sorted.
When I examined him, it was an usual problem where most of the people undergo this type of issues regularly in a day-to-day basis. If you see that after age of 40 years, invariably, whether they may have a injury or may not have an injury, most of the time, even without injury, they will come with these issues. So when there is an issues without injury, that is the where we have to find out the cause and the diagnosis to treat. Anything related to the shoulder is not everything same. Like, people come with a frozen shoulder. That is a very common term for everything which is related to the shoulder. But why the shoulder has been freezed or the frozen shoulder has happened, that is the way you need to pinpoint and get to the diagnosis.
When my frozen shoulder started, so I took I wanted to avoid a surgery on my shoulder as recommended by one of the doctors. But then I did take some physiotherapy session, but the physiotherapy session initially went well. But what happened was after one of the session, the condition drastically went into a downspin. It hurt very badly. I think they did a wrong treatment or something they did which was not supposed to be done.
When you do an MRI scan in a very acute stage, that is when there is a severe pain, all the shoulders looks like there is a tear. Whether for the beginner, they will think that this is a tear and try to put the needle, put the knife and try to repair it. When you assess the same clinically, you will see what exactly the diagnosis, how to proceed with the treatment. That is where the important or the clinician's expertise comes down. Since I know that when even I am also myself in a gym worker, I do get a pain regularly when I do a more heavy work and when try to do the little bit of excessively. But I didn't undergo treatment or I didn't undergo surgery. So why should I allow somebody to undergo surgery? So this is my main idea and main point of view about it.
I came to Dr. Jagadeesh with an open mind. Okay, I'm ready for a surgery. But then when I came here, doctor said surgery is not required. I was on cloud 9 hearing that. So he recommended me some physiotherapy sessions.
Nature shows that when there is a severe fatigue or severe exercises given to the shoulder or severely strain given to the shoulder, the nature try to protect the joint by giving stiffness. So stiffness is a nature's protective mechanism. And here is the one we have to give some time for the nature to heal by giving some more rest. And once the pain subsides, then we can think about the mobility. So that is the main part of the treatment. So my point of view is, by seeing an MRI, if there's a small tear, no, you should never go for a surgery. These are the cases where they do very well if you combine a proper physiotherapy, in the sense rehabilitation.
First few sessions they did some needling that absolutely brought mobility to almost about 90%. When I started, the mobility was not 40 or 50% also, but it almost became 90%. I was really thrilled. So I'm very happy about it now.
With the needle, he tried to find out where the pain is and released. So that gave him a very good relief immediately. And next is the one, once the pain gives immediately, pain comes down, then we go on with the mobility. So almost I think some around 1 week to 10 days, he got a very good improvement in his shoulder, almost a nearly full range of movement, probably around 5 degrees, which will be the residual, that gives slowly come to a completely full also.
Yeah, so my first impression when I came here with a MRI and my reports, I think he was able to pinpoint a particular, I don't know medical jargon, but he was able to identify the problem. And the first thing he said was, no surgery required, let us try to solve it in a different way. Let's try to solve it this thing. I definitely, for those of you who are not fans of surgery or getting under the blade, I think they should meet Dr. Jagadeesh.
I would like to thank Mr. Subramanya Kushtagi very well that to trusting me that in avoiding surgery for him.
On the contrary, I should be thanking him, and I'm very grateful for his. Thank you.
Thank you.